Welcome everyone to this Google Hangout panel discussion on the need for a system that displays real-time information on the availability of emergency medical resources, that is ICU beds and blood in Mumbai city. I'm Dr. Aparna Hegde, the founder of the NGO ARMMAN, and today we're going to discuss about a topic that's extremely close to my heart. When I was doing residency in Sion Hospital in my second year, when I was doing allied posting in neonatology, one day at 2 a.m. in the night, the distraught parents of a little baby who has just been born and was dying was brought to the NICU. The NICU did not have a ventilator bed free, and that's why my registrar told the parents to take the baby elsewhere. 4 hours later, the parents brought the baby back and placed the baby at the feet of my registrar and said they'd gone to KEM, Iyer, JJ, and 2 other private hospitals, and none of them had a ventilator bed free. The distraught father said, "Do what you want with the baby, I don't know where to go." Needless to say, the baby died. I saw this situation play itself out over and over again through my residency. And same was the situation with blood. One story I remember even now is that of this patient on 25th December, she'd been transferred from the periphery of Mumbai, from Thane, to Sion Hospital with postpartum hemorrhage, that is bleeding after delivery. She required at least 10 to 15 bottles of blood, but Sion Hospital Blood Bank that day had only 2 bottles of blood. We spent 45 minutes calling every blood bank of Mumbai city, and by the time we found that blood was available, she was dead. This gave me the idea of HERO, that's Helpline for Emergency Response Operations, which is one of our projects. HERO hopes to provide real-time information about availability of ICU beds and blood in all the hospitals and all the blood banks of Mumbai city through a phone number, an SMS auto reply system, a website, and a mobile app. We hope to save those precious minutes between life and death, those precious minutes in which currently patient can be running from hospital to hospital trying to find an ICU bed or blood. It's our hope that every hospital blood bank of Mumbai city come on board. However, it's one of the hardest projects to implement, as will be evident in the panel discussion that follows. Today, we are very lucky to have very eminent panelists and stakeholders in the well-being of Mumbai come on board this discussion. We have Dr. Supe, who's the Dean of Sion Hospital and has always been a supporter of ARMMAN and HERO project. We have Mr. Banthia, who's the ex-Chief Secretary of Maharashtra and has always been wonderfully supportive of ARMMAN. We have Dr. Rekha Bhatkhande, who is a Dean of Shushrusha and an eminent gastroenterologist. And Shushrusha Hospital is the first one amongst many private hospitals who have come on board HERO. And we also have Malathi Iyer. She's a senior editor for health for Times of India. Thank you, everyone. And I'm going to go on to Dr. Supe first. Dr. Supe, can you throw light on the gap between the need and the availability of ICU beds with ventilators and blood in the municipal hospitals of Mumbai? Is it easy to get information about whether an ICU bed in Sion Hospital is available before the patient is transferred to Sion Hospital? Dr. Supe?
Cause is on Saturday, Sunday, many people want to go out and they want to transfer all critical patients to public hospitals. So we have to refuse practically 3 or 4 on weekends patients who are likely to be transferred. In addition, there are many patients who come to us directly. There are no requests. These patients are brought by 108. Now 108 has created more problem for us because they directly bring the patient and bring into casualty. And then they say that the patient needs a ventilator and we don't have a ventilator. Then we have to maintain patient on AMBU. And then we have to wait till a ventilator is ready, or we have to transfer that patient to another hospital. So I think the need is definitely more than what we have. Now the issue is, how do we really develop a network? And I think we tried it with ECAM. ECAM is one foundation which helped us last year. And we have given them a table and in the Dharavi, and they have a helpline. So they try to help you for neonatal babies and the PICUs. So they try to give answers, but this is not very popular. So if somebody really develops a network where your on-time kind of a thing is filled in, and this is being accessed by all other the places who can really check, and then they can call and find out and confirm that there is a vacancy in kind of an ICU, and then that transferred, a coordinated transfer. I think that would be a great help. And so I feel this kind of a project is definitely necessary, but there are many angles to these projects. It's not going to be as simple as keeping just a desk. There are many people who would come uninformed, so we have to also see what we do about them.
Thank you, Dr. Supe, for throwing light on the problem in Sion Hospital and other municipal hospitals. We go to Dr. Rekha now. Dr. Rekha, is this a major problem for the middle class citizen of Mumbai too? Have you come across any situation where a middle class Mumbai person has been forced to run from hospital to hospital to find an ICU bed or blood?
Hello, yeah. Like all tertiary care hospitals, at Shushrusha Citizens Cooperative Hospital, we too have a dedicated ward, especially staffed to look into for critical care patients, where observation, care, and treatment is given to anybody who comes with a actual or potential life-threatening disease, illness, injury, or complication of any previous therapy. So now what we find is that as ours is our hospital is located in a middle class locality, and we find that there is more than 4-hour wait in our emergency medical service unit for a patient to get admission into our ICU, and almost more than 24-hour wait for a patient who is to be transferred from a non-ICU hospital, a neighboring hospital, or a nursing home. And so there's definite need for ICU beds, and we sometimes have to then turn away patients who are critically ill after stabilizing them, of course, in the EMS, and also refuse our consultants ICU bed because it's not available for their outpatient. Now, yeah, that's the reason why. That's the reason why, Aparna, actually, I started a networking of local hospitals in G ward, so that there would be easier communication, and we could then alert the hospitals. That is, we have 4 hospitals that we've networked: Hinduja Hospital, Fortis Reheja, Dhanvantri, and Shushrusha Hospital, and so that we alert the other hospital that we have a patient who needs a ICU bed, we don't have one, and whether they could accommodate the patient. Now, similar things do happen where blood is concerned as well, and because of the non-availability of the particular blood group, then patients run from pillar to post, and especially they have to go to very far off blood banks at unearthly hours. And that is why I was very keen to, in fact, I supported a young NGO of young students and ex-students of Mumbai University, where they started this blood on call, helpline, and now I've taken it to almost 166 colleges all over Maharashtra, where where a blood registry is being kept of students, and blood being made available to the local blood banks on demand.
Dr. Rekha, thank you for the response. Dr. Rekha, did you ever come across a story where you have seen a patient yourself running from pillar to post?
Oh yes, we had a patient who came in at about 1:30 a.m. and this patient had come to us from a neighboring hospital, saying that it was the patient had been kept in the EMS for about 6 hours, and after that they said that the ICU bed was not available, and without checking with us, the patient was brought to our hospital, and unfortunately we did not have an ICU bed. So we rang up another neighboring hospital. Like I said, we're networked, and there was a bed available there, so we sent the patient there. The patient relatives went there, took the patient there, and for whatever reason, they did not admit the patient there, and brought the patient back to our hospital. Now, can you imagine? This must have taken about 1.5 hours. Now, so when my register in the emergency medical services rang up and told me about this, what I told him was, okay, I opened up my daycare unit and transferred out a stable patient, and then took this patient in because he'd already lost a lot of time perhaps because of the behavior of the relatives themselves, but that didn't matter. It was the patient who mattered. So we rearranged, transferred patients out at 2:30 a.m. and admitted this patient. Yes, it's a very harrowing experience for patients when they do not get an ICU bed and they really need it.
Thank you, Dr. Rekha, for this wonderful response, because this is an issue that we really want to highlight with Hero. For the next question, I'm going to Dr. Banthia. Banthia, sir, India is very prone to disasters and terror attacks. Do you think that a real-time repository of information regarding ICU beds and blood can help the government efficiently coordinate emergency medical resources?
Good morning, Dr. Aparna. Good morning to all the panelists. Let me congratulate you at the outset for initiating such a debate and also highlighting the need for such quick responses. I'll definitely attend to the issue which you have raised about the natural disasters and the terrorist attack. But a couple of issues which you raised and some of the panelists have put their views, let me dwell on that as well. The first thing is real-time data is what is the new technology allows us to do in all matters of governance. And there cannot be two issues that in questions of life and death, obviously we require the real-time data in any case or real-time information as such. Now, the improvement in the public service delivery is what the modern governments are trying to do, because obviously governments are involved in hell of a lot of services which are required by the public. In a matter which involves life and death, obviously the government has a very key role to play. Now, whether there is a natural disaster or there is a terrorist attack, a place like Mumbai and generally in India, we have literally by the hour a disaster, if not a natural disaster, it's a man-made disaster, for example. And therefore, there cannot be two opinions that we require such a facility, such a service. Who is going to anchor it, whether it will be anchored purely in the government, whether it will be anchored purely in the private sector, or it has to be a combination, is something which we need to work out. And I think the last possibility is the best thing I can think about, which is a combination of the government and the private sector as such. And that is where MCGM and Dr. Supe and his team and MCGM should lead the way in my view. But Mumbai is going to be a small drop in the ocean, but yes, we are focusing on Mumbai, so it's extremely important. Now, key issue here is, are we only looking about the availability of the ICU beds and the blood, or we are looking something much beyond the basic infrastructure? Dr. Supe raised a very pertinent point that are people going to share this information, and in addition to the emergencies which are going to arise, as I said, man-made mostly, how are we going to deal when people who are not coming through this route, how are they going to be entertained? And the pressure on the infrastructure of ICU, ventilators, and so on and so forth. Another issue is when we throw up this system open to the public, and there is some level of commitment. First of all, that there is a bed available. Number two, there is the ventilator and supporting staff which is available. And in any case, we are running short of the doctors and the nursing staff of critical care in any case. So my take on this would be, India does require the emergency or the critical care system developed very, very urgently. Mumbai Corporation hospitals, since Mumbai Corporation is one of the few corporations in the country which is running medical colleges as such, need to initiate the emergency medical medicine as a part of the curriculum. In any case, strengthen it considerably. It is there. Recently, Dr. Supe and myself, we were involved with API only last week, where there was an excellent session on the emergency medical care as such. So I would say that Mumbai is the ideal place. We need to take the initiative, and I am willing to support anything in any capacity in coordinating. And my take would be that don't wait for a natural disaster or a terrorist attack. Mumbai is known is a soft target for terrorist attack as such, but we don't have to wait. All of us know that there is enough emergency every hour in Mumbai, and we need to attend it. So let me say that we have to put our heads together, put our acts together, and implement this.
Thank you so much, Banthia sir, for the wonderful answer. We go back to Dr. Supe. Dr. Supe, I would like to congratulate Science Hospital for taking the lead in partnering with ARMMAN for Hero. We've now computerized the admission counter of Science Hospital to be able to get real-time data of ICU beds, and we have also implemented a barcode system in the blood bank of Science Hospital. It's being installed there right now to be able to get real-time data of blood from Science Hospital. What do you see as challenges in expanding the system to other municipal and government hospitals?
See, I mean, it definitely we can give data every 4 hours or 2 hours can be updated. I mean, that is what probably we need. Okay, these are the bottles available. But actually, I mean, I don't know. Do you have an idea that we issue 1 bottle of blood, 1 will get reduced? So do you want something like that to be done? Because if that is so, then we will have to have something like a system placed in the blood bank, and then as soon as somebody issues a blood, it will get deleted from that particular system of information. Now, if you want that kind of a system for blood bank, that can be done. For the beds, I think somebody will have to feed it every 4 hourly or 2 hourly, or whenever there is a transfer, again somebody says. So there has to have a MIS system place in every place which is connected to you. Now, if you are able to do that, I'm sure we can really do that. But when you are trying to do it all 16 hospitals or 18 hospitals of corporation and other hospitals, if you want to rope in, it's a very big amount of project. Now, do you really want to do that at the beginning, or do you want to start pilot with few hospitals?
To answer that, sir, we've already actually, if you look at the admission counter of Science Hospital, it's already computerized, and we're in the process of doing that, hopefully with the ICUs of Science Hospital. And with the blood bank, the barcoded system that we're installing in the blood bank will actually give you real-time information about, blood coming in and going out. And that system actually can be easily replicated in all hospitals, I mean, and we would like a support for that, to do that, because once it's proven to work in Science Hospital, it can expand to other hospitals. But do you think that there will be, once we implement it really well in Science Hospital, would other hospitals, municipal hospitals accept it if it can be replicated easily out across them?
I don't know. We'll have to really ask others how open they want to be, because in a blood bank like this, we have lots of other issues, like we have blood reserved for some elective surgeries, and it will be shown as available for emergency. So you will have to really see that, okay, this is a blood available for emergency, and out of which we have issued it, something like that. So if people are very open to this kind of a data, I'm sure it can be done, but many people will not be there. So that is what we'll have to really talk to them before. And we'll have to tell them, okay, the need of the system is like that, and all that will have to be done, because there are a lot of issues with this.
Dr. Supe, actually about the reserve blood is a very good point you've raised. We actually, are giving a choice to the blood bank to actually show that some blood is in reserve. So only the blood that's not in reserve will be able, the external.
Fine, that's okay in that case. That's fine. So it is available blood should be shown.
Yes, available blood will be shown.
Available for people, which can be really given to somebody who comes walk in. That can be really shown. So that, okay, we have say A positive 17 bottles available, B positive 10 bottles. We can show that, and then people can come and collect that blood.
That's a plan, sir. Yeah. Can I go to Dr. Rekha? Dr. Rekha, similarly, would like to congratulate Shushrusha Hospital for being one of the first private hospitals to come on board Hero. What do you think will help us convince other major private hospitals to come on board? I'll be very honest, it's been very hard for us to convince private hospitals to come on board. Because they have apprehensions. Some of the apprehensions are, some hospitals are concerned that showing vacancy will negatively impact the image of the hospital. Or that, others worry that they will not be able to charge the patients for care, despite the fact that we keep telling them the Hero is only a real-time information system. And it's not a system that promises care, free care. So even though we tell them that we are not promising free care, we only give information about availability of beds and blood, the hospitals are worried that patients will come there using Hero system and expect free care. Do you think these concerns are valid? The fact that if you show beds, it negatively impacts the image of the hospital, and also that patients will expect free care. Do you think these doubts are valid?
Dr. Aparna, the day the Hero Project personnel came and met me, I was so taken up with this entire project that, I'm a cooperative hub. And one of our, our motto is that healthcare should be easily available, it should be accessible, it should be affordable, it should be that all hospitals, private or otherwise, are concerned, accountability of healthcare is a must. And frankly, clinical care preparedness is something that all hospitals should to aim at. And if you were to look at the websites of the private hospitals and their blogs and their online information, they're all talking about ICU, the number of ICU beds they have. So I really see no reason why they should not be telling us about the vacant or the availability of those ICU beds. One thing we have to take into consideration is that when people are very sick, very, very sick, critically ill, they would rather go to nearby hospitals. But if the nearby hospitals do not have the facility that they need, then in that case they should have a method of finding out whether a remote hospital has got, for instance, an ICU bed available, and whether when they do go to a remote hospital, that hospital will accept them as a patient. And that's where I think your Hero project is and will do a wonderful job, because patients then can go straight for the treatment that they need, rather than hopping from hospital to hospital, or from care to care. So I think that's very important. The other thing hospitals should really mind, I don't think it damages the image at all. Why image? To be able to give the best care that you can to somebody who deserves it. Now, the same thing actually is with blood availability. The blood and blood products are today, now when you're talking about costing, today the government has made a regulatory charges for the blood and blood products. And I'm sure if the implementation of the Clinical Act, the Clinical Establishment Act comes in, then I have a feeling that even the ICU charges and everything will be regulated. So I really don't think that today we should be so bothered about patients coming and telling us. Everybody knows that an ICU bed costs a lot of money. Nobody expects it to be free except patients who are BPL, that is below poverty line, and some concession given to patients who are just above poverty line. But otherwise, I don't think patients expect critical care to be given free. Is there any other question you'd like to ask, Aparna?
Thank you, Rekha, Dr. Rekha. I'll go on to Malathi. Is Malathi there again? Yeah, I'll go on to Banthia sir. Banthia sir, Dr. Supe had raised a very, very important point. He raised this point that 108 has really worsened it for them, because of 108 patients come in and then there are no ICU beds available. That means that even 108 ambulance system actually requires real-time information about availability of ICU beds, so that they can take the patients to the hospital where beds are available. So do you think that such a system is apt for public-private partnership? Government has started 108 ambulance system and the 104 blood on call system. Do you think that the government should partner with such a system like Hero, so that both 108 and 104 can benefit from the information regarding availability of ICU beds and blood?
Thanks, Dr. Aparna, for raising this issue. I'm happy that you raised the issue of 108 and 104. But let's go into the genesis as to why government had to intervene and introduce 108 and also the 104. I remember there's one Dr. Naveen Shah who comes from Washington every year for the last 10 years and trying to ensure that all the ambulances in Mumbai, they should come under one umbrella. Last 10 years, we could not do it. Now, therefore, the key issue is that what Dr. Rekha mentioned and Dr. Supe mentioned, nobody wants to give their own domain as such, whether it's blood, whether it's the ICU, or it's the general beds as such, or their own doctors or their own facilities. And that is more true about the private hospitals. There appears to be an issue that the private hospitals don't seem to be running for public necessarily. They seem to be running for a small set of people, it looks like, once in a while at least, I would say. And therefore, that's a major issue. Let me elaborate that point. Government of Maharashtra also came up with the Rajiv Gandhi Arogya Jeevandai scheme, where according to the scheme, the hospitals were provided that they would get a fixed amount, which was decided by the experts, for carrying out elective surgeries as such for the poor people, the below poverty line, etc. Most of the charitable hospitals in Mumbai did not join this. So there are double standards which are being operated by the so-called private hospitals, particularly those which are charitable also, which under the law are supposed to share 10% of their beds free of cost to the poor, 10% for the indigent. OPD is supposed to be subsidized actually. They get all sorts of concessions from the government, central government and the state government and the municipal corporation of Mumbai, but at times some of them do not return back to the society what they are trying to get actually. Now the answer to your question is yes, government started 108, government started 104 as a response to what was the hour of the need. Actually the government was much delayed in this action, let me say that, and government needs to partner, there's no doubt about it. I would agree with Dr. Rekha that unless everybody would like to share this, today my hospital has a patient which requires an ICU bed, I do not have it. Now am I not supposed to have a counterpart in the same system where I can ensure that this patient, where is a question of life and death, should be able to share an ICU, should be able to share the blood or whatever, etc., etc. So today I may be in requirement, tomorrow somebody else will be in requirement. I would appeal and urge everybody, particularly the CEOs of the hospitals in Mumbai, that everybody needs to give an inch so that you create a bigger space for everybody, because it's in public interest and not private interest. If you are going to run hospitals and ICUs and blood banks for private interest, then it's a different story altogether. But the key issue is if all the hospitals are largely, not fully, largely for public interest, they need to come on the same platform, and government, I'm pretty sure, would be happy to facilitate this. This is not to say that people are not happy or they're very happy with the government as such. There are irritants in the government and that can be done. My appeal right now would be within the MCGM, can MCGM hospitals come together? Why not all the MCGM hospitals? Why do we require to run a pilot for several years for these things? I think we are delaying things unnecessarily, and my suggestion is that we should kick off straight away with the MCGM. Those of the private hospitals, those of the charitable hospitals, those are the hospitals which are with central government. Central government in Mumbai runs a huge set of hospitals. The railways are running, the defense services are running, Customs is running, everybody is running a different set of hospital. ESIC is running a set of hospitals. We need to bring them on a platform. As I offered you earlier, I am willing to facilitate this.
Thank you so much, Mr. Banthia. This is what we are trying to do with Hero, trying to get private and government hospitals all on one platform so that we can provide information that's necessary to save lives, which should be above all, other interests. Now, I would like to come to Malathi. Malathi, thank you for coming back into the discussion. As I'm going to have you ask you two questions, one after the other. Now, as an esteemed health journalist in Mumbai and as someone who has been a chronicler of health in the city for years, I will ask you to be the voice of the common man or the common woman. Would such a system help the common man? Would you want this for your family? And why? Because we really want the common person of Mumbai to say that what they think about a system like Hero. Thank you so much, Malathi.
Hello, can you hear me? Hello? Hello? Hello?
Yeah, we can hear you.
Great. Okay. I think a system like Hero should be in the need of the hour. We have seen, even last year, we saw a child who was born in Chembur, in a Chembur hospital, dying because his parents they kept running from one hospital to another and they couldn't find an NICU bed. Of course, one wonders how would Hero connect? How would Hero connect with this common man? He doesn't have access to internet. He doesn't have access to information. So how will he know? Even how will he know that there is a bed in KEM? How is a bed that there is a bed in, say, a Surya hospital? How is he going to know that interface? We have to somehow educate the people about it. So even though at one level you do need a Hero project, how do we let the common man know that yes, indeed, there's a bed here? I mean, how is he going to benefit by that? So that is my question back to you, ma'am, because there should be some kind of how is he who is so unlettered going to benefit from it?
So it's a very beautiful question you've asked. The question that the way that a common man will come to know is that we're actually going to have a phone number. You can call a phone number and get the same details that you can get on a website or a mobile app. So if you have a smartphone, you can download the mobile app, and everybody now has a phone, literally. So we would like to actually get the phone number popularized, so that the data is available to the common man. Only that we need to have more and more hospitals join in so that we can give. Otherwise, a system like Hero cannot work. Because we need to have information of almost all hospitals of Mumbai city on Hero. Another question that we would like to ask Malathi ma'am is, how do you think that the media can help us support the cause for a real-time information system in Mumbai? I mean, media takes up numerous causes, It takes up the causes of Swachh Bharat, it took up recently, and Times of India takes up a lot of causes. How do you think that media can support us in raising this issue on a larger scale?
I think every time we come across an example of how a family or how a child was saved, that should help us. That tells the entire story, doesn't it? Even if one family benefited through a Hero project, a real information system, then that gives credence to such a system, right? So media will basically do its job in informing people about such systems, about the benefits of such system, but we need to first find out. We ourselves didn't know that Hero is already operational. So, I mean, how many people have used it? Is there any way of finding out how many people have benefited from it? That would be a way of, and then of course we write about it. So that should help us. That should help the people.
Thank you, Malathi, for that answer. Initially, we actually have to get all hospitals on board Hero before we can actually show the benefit of Hero, and hopefully that will happen in the near future. The last two questions are for all the panelists. Each of you have 2 minutes to voice your opinion. And so the first question is, Now, there are numerous reasons why a system like Hero might be too difficult to implement. I mean, we can think of so many, and I have been told so many by the private hospitals why Hero can be difficult. But do you think that saving a life, whether in a personal emergency or a mass disaster, is a priority? Shouldn't all reasons voiced lose their ground in the face of what is a human right? I would like all of you to kind of talk about whether saving a life should actually take precedence over everything else. Dr. Supe.
Can I begin, Dr. Aparna?
Yes, you can, sir. You can. Mr. Banthia, you can.
I'm pretty sure that nobody will have two opinions, that saving a life is much more important rather than caring about various protocols here, etc. Protocols have to be in place in any case. I work for another NGO. I'm their technical advisor and their board, Save Life Foundation, which put up a public interest litigation regarding the accidents on the roads and so on and so forth. And one of the projects which we want to kick off this year, which I mentioned to Dr. Supe last week, is can we make Pune-Mumbai expressway fatality free, not accident free. So, because accident free has a lot of implications, but can we at least make it fatality free and not in 6 months' time and 1 year's time? We want to do it 3 years, which will involve several things. So, the answer to your question is yes, we need to kick off straight away. Saving life is far too important. I think the considerations which go in evaluating the cost of a life is pretty negligible in our country because of apathy. A lot of misgivings are there. The governments need to improve, there's no doubt about it. The health systems need to improve. And if there is a fear of the unknown of the private sector hospitals from the government, let the government and the private sector hospitals come on the same platform, discuss, debate, remove the misgivings, the unknown fear, the known fear, rather than each one of us hiding in our shell. That is not going to take us far too much. So my request to you is, we would facilitate this, and I'm pretty sure when we got stalwarts like Dr. Supe, other people from MCGM, Dr. Rekha, and there is a CEO's forum of the private hospitals in Mumbai, which I had the opportunity to discuss several times. I'm pretty sure some of them will get around because this is something in public interest. I don't think we require a directive from or a mandate from the courts in this matter. We don't require a political or an executive fiat. People in the country are getting more and more conscious of what is good for public, and I'm pretty sure if there is a clarion call for this, people are more likely to respond. There will be challenges, there will be some issues. The CEOs are going to come that we have to go back to the trustees, etc., etc. All this can be negotiated because, as I said, at the end of the day, nobody knows who is going to benefit. The private hospital, the trustees of the private hospital, the CEOs, or the common man, or persons like you and me. Within the government system also, if there is a quota system for the VVIPs, that also needs to be curtailed dramatically, if not fully. That is my suggestion. Thank you.
Dr. Supe, would you I know it's very hard to spread Hero across government hospitals, but do you think that it should be something that should be taken up by government hospitals because saving a human life is a priority?
I think giving information that the bed is available or the blood is available and provide it is quite a nice thing, because unnecessary transfers and people's agony that they come and they don't find there's a bed, these all will reduce. The question is of when you're talking about a saving life is very important. I think you all realize that the public hospital pressures are going up. There's definitely more need for ICUs. And maybe sometimes it is artificially created by the peripheral hospitals and private hospitals, that even if there is, 20% maybe unnecessary patients putting on ICU also. But ultimately, see, if you feel in patient's mind, this patient needs an ICU bed and this patient needs platelets, and then they are referred to us, and when our doctors say that it is not really necessary, it creates a lot of tension amongst the relatives, and then there's a political pressure. So that's the other side of it. But genuine patients should definitely be saved within a golden hour, and these kind of systems will help them. The issue is the government or public hospitals have limited resources in all terms. Now I cannot go suddenly expand my ICUs from 14 to 30, and even if I do 30, they will be always in short because there will be more demand which will come. Now see, KEM had more than 30 beds and now they have expanded to 64 beds, but still there is a shortage of ventilators. So ultimately it's like how much you do and how much you can really go in. So giving an information is okay that it is available, but I don't think we'll be able to cope up as a public hospital with the amount of need which is there with the currently government's policy of GDP only 1.5%.
That's a very valid point you raised, but because there is a big lack of, I mean, you don't have enough ventilator beds. That's the basic reason that you need a system like Hero, because we don't have ventilators. You need to really ensure that information is given to the
How
public
many
or
people
available.
will, Aparna, how
Yes.
many people will access internet or phone lines before transferring patients? Not more than 10%.
Sir, phone call, yes. You would call up. You would call up your relatives. If it's a number like a 101, literally, that's somebody knows, and the Hero number becomes popular. That's the first number people should be able
Yeah.
to think of.
No, because our experience with ECAM for 1 year, I think
Yes.
we had experience with ECAM where we're now trying to organize neonatal and all. I think we find the use is not more than 20% or 30%, and the Hero will also remain like that. So it's worth doing it. I'm not saying we should not do it, but don't expect that 100% it will be accepted.
But that's always a beginning, sir, and that's why hopefully Hero is a
Yeah.
beginning. And Malathi, what do you think as a media person? Shouldn't this become a priority? I mean, private hospitals and government hospitals, shouldn't they take this up as a priority?
Ideally, in an ideal situation, certainly, it would help. It would help so many families. I think once we begin such an exercise, once people get to know, once there is a kind of critical mass of hospitals, like you said, who get into Hero, then certainly people are going to know more and more about it, and they will ask for it. Wouldn't they ask? I mean, if there's a family which is in distress and they know that there is a facility like this, or somebody knows about it, I think it should help them. It should definitely, we should at least try it out, before saying that it won't work. I think we should try it out.
Thank you, Malathi, for saying that, that we should try it out, because we plan to go live with the 11 hospitals who have come on board Hero, and hopefully then it will motivate other hospitals to come on board and follow hospitals like Shushrusha, who've been pioneers actually, who've been taking the lead in coming on board. And thank you for that, Dr. Rekha. Dr. Rekha, would you help us, because you've been the one who actually has put together, a committee of hospitals. Can you help us get more hospitals on board?
Yes, definitely, Aparna. I think that should be one of the tasks that you have now set me, and I should take it forward, because there are two issues that in fact I would like to address here. One is the futile treatment that is being given in ICUs. That is, patients who don't really deserve to be kept in ICUs are being kept in ICUs. And the second is that prolonging life without any benefit to the patient, just because the facilities in the ICU can do that. I think this is being addressed very avidly and strictly by people in the ICUs, by their transfer out criteria. They become very strict about that, and I think that should not be there. I think the major bigger ICUs are definitely following these transfer out criteria, and futile and unnecessary admissions in ICUs are and should be down to minimum. But why I would really like this system to come into place is because we find that getting personnel, trained, experienced personnel for ICU is very difficult. And one day I think that whole electronic ICU, the whole idea may need to be brought in, the EICU, and in which case every hospital that has a intensive care system will need to be looking at real time and online data going back and forth, and you're getting advice from people right across the country, because that's what EICU can do. So I think, yes, your system should be in place, and I don't think it should really affect any stakeholder. And should other hospitals come in? Oh yes, definitely. In fact, the Association of Hospitals is in place, and that's got all the private hospitals on the panel, and I think I'll put forward to them. Malathi is smiling, but
Aparna,
Yes.
Aparna,
Yes, sir.
just now we are talking. I had 2 calls about ventilator requirement
Oh, you did?
from
See
many
that?
ward.
See that, so we're
And
hoping
I
that
think,
instead of you getting the call, Hero gets a call, and then we can guide, whether ventilator bed is available in Sion Hospital or not. And one more thing
yeah,
I
I
must realize
got,
about Hero is it'll give you real data, because we talk about how we don't have enough ventilator beds, but we don't really have data about how many were required and what is the gap. A system like Hero, if you have calls coming in, you'll actually be able to get data, and government will be able to understand how much more need is there to expand emergency services in Mumbai.
Dr.
And
Aparna, let me chip in.
yes,
Now,
sir.
when the swine flu epidemic broke out, the state compiled this information not only on the ICUs, about the ventilators, about the availability of the ventilators, functionality, improving the capacity. And Maharashtra did extremely well, particularly the city of Pune, for handling this emergency of swine flu over there, etc. And I remember the MCGM and Mumbai hospitals coming forward. As a matter of fact, Mumbai did not witness, fortunately, the swine flu epidemic in 2010 and 11. So we are quite capable of doing these things, number one. Number two, the point I was raising, and I'm happy that Dr. Rekha mentioned the association of the hospitals in Mumbai, the association of the CEOs. Obviously, they need to be brought on board. Their known and unknown fears need to be worked out, and obviously the government needs to be more responsive, particularly the fear that the political executive or the bureaucracy or the government as a whole could make their life little more difficult. But this is not to say that they use their discretions. When the discretions come from within, it's not treated as interference, but when this interference or this request come from outside, then there is a challenge in any case. Now, the only point I wanted to bring around is that let us take the case of the outcomes of pregnancies. These are very well known predictable events. Now, the government in Maharashtra at least started a scheme in 2 hospitals, one in Baramati, the other is in Sholapur district, where a pregnant woman could book her bed that I'm going to deliver on 15th of June this year. Can you book a bed for me? Now, this is a simple thing which we started and things have started picking up. For a predictable event, if you can start, and therefore the government hospitals could really be sensitized that booking a bed is a very ordinary thing in today's life, when you can book a ticket for your hotel, when you can book a ticket or you reserve your seats in airlines, you can say book a ticket on your railways, you can book a ticket in a cinema theater. So sharing of information, that is what this has allowed us to do. Here we are talking about an emergency, and as I said, everybody has to give in a little so that the public at large is the beneficiary.
Thank you very much, Mr. Banthia. Mr. Banthia, there's an audience question actually from Dr. Kumar, and he's asking, why can't the government make it compulsory for all government and private hospitals to join such a system? Because it's for public good.
Well, as was mentioned by Dr. Rekha about the Clinical Establishment Act. Now, who is opposing it? Come to think of it, it's the IMA of all things. So, a lot of things, have to be the Clinical Establishment Act, which would have provided the databases on everything which is the healthcare industry which is requiring. So, there are a lot of wasted interest. Now, forcing by the government leads to unnecessary litigation, number one.
Okay.
Number two, it leads to political interference, and therefore that is not the best way. Is it not the need of the hour, which everybody understands this? And therefore my take on this would be, it is easy to legislate, difficult to implement. Therefore, why not start straight away? Let everybody give an inch and there will be enough space for everybody.
That's a wonderful thing you said, and I hope that after this panel discussion, all the panelists, that is Dr. Supe, Mr. Banthia, Dr. Rekha, and even Malathi, can help us get hospitals on board, because of the connections that they have. Anyways, going forward, but another question for Dr. Rekha. The private hospitals are really worried on coming on board. So there's a question that has come. So why are the big hospitals, the private hospitals, so hesitant in joining Hero? Do the administrators and doctors in these hospitals not realize that someday they may need to find an ICU bed of blood in an emergency for their own family members?
All of us have been saying this. All of us may require, you never know. Please join.
Yes. Thanks. Lastly, yeah, Dr. Rekha.
Aparna, the problem is really that the ICU bed, our capacity is very, very small. That means we have the people requiring intensive care is more than the number of beds that we can offer them. So what happens is that quite often the hospitals, the private hospitals, the consultants, they would rather not, it's like open it up to the public. I mean, that's what it comes to. I personally feel this is wrong, because after all, it's a deserving person who needs it. And the other thing is the issue of my patient, your patient. So it's like this: if somebody's patient lands up in a hospital where that doctor is not attached, then there is a lot of ethical issues that can come up, and practice issues and things like that. But I think all this can be solved, because more important is that I feel very sorry when cardiac ambulance turns into Shushrusha driveway, and if you've been to Shushrusha, it's a very narrow driveway, and then the patient is offloaded, brought into my EMS, and then the EMS doctor has to very unfortunately tell that patient, you need an ICU bed, but sorry, I don't have one. I would not like that to happen to any patient. Even those 5, 10, 15 minutes is a loss. It's a transfer. Patient transfers from ambulance to trolley to bed in the EMS. These are not something that you want, you see. So I definitely think we need to have a system in place where at least you do not do a futile, you don't go to a hospital to be turned away, because that's also psychologically very disturbing to patients and their relatives, because they become extremely agitated when that happens, and that's how all the violence that occurs in the hospitals and against doctors and all, because patients are being turned away because they don't have the beds. And for that, one of the things is, of course, to be flexible critical care resources. I mean, so we're saying about, it to be available everywhere, the way we book tickets and things like that. So I think
Can you hear Dr. Rekha? Hello? Yes, Dr. Rekha can't be heard. Dr. Rekha, I think, has...
We can hear you, but we can't hear Dr. Rekha.
Yes. So, Malathi, there's an audience question for you. So, what can the media do to help to make this a citizens' movement? Is a question from Mr. Sanchi. What can the media do to, because it is basically for the citizens of Mumbai, and the citizens of Mumbai demand this service, because ultimately it is you and I who is going to go and need this service. So, what can the media do to help create a movement among the citizens of Mumbai to ensure that hospitals join Hero?
Journalists, or the media only reacts to movements. We can't create a movement if there's none in society. So it is a call in society which we can amplify. We can, if there is, like Dr. Bunce, an NGO, or there is group of citizens who are willing to take it up, we write about it, we amplify it, we amplify the need for, the call. And that is basically, it has to come from the people, and then journalists get into the movement, right? So
yes,
definitely, but journalists, we would like to write about it, definitely. There's no two ways about it.
Thank you so much. So, I'm going to actually ask Mr. Banthia. This is a very valid point. I think elders of society like Mr. Banthia, that Dr. Rekha, actually, if you could help us create a citizens movement around this, to put, throw light on the fact that the system is required.
What I would like to say is that we should not be at the receiving end. Only when we are at the receiving end, we remember the system, and that the system should be in place. And when we talk about the system, then we talk about governments. So I think, fortunately, all of us are sensitive enough that we don't have at the receiving end that you yourself or one of your relatives or somebody in the family has met an accident and then you require an ICU bed and then you require the blood. That you remember the system. All of us need to work in public interest and public good without waiting the government to legislate, without the courts giving mandates here, etc. It should come from within. The mandates from the government and the court should be the last option. And for a city like Mumbai, which is very sensitive to the needs of the people, I'm pretty sure with much more persuasion and efforts, bringing people on the same platform, all the stakeholders, it should be possible to do. We need to persevere and we need to be patient both.
Thank you so much, Mr. Banthia. So last question. This is actually a call to action. What do you think that the different stakeholders, Dr. Supe, what can you do to help us? Mr. Banthia, Dr. Rekha, and Malathi, I mean, what can we all do together to make the system a reality? We all have agreed at the end of it that something like this needs to happen. So what do you think we can do?
Ultimately, our goal is to see how we can help maximum number of patients to save their lives.
Yes.
I think if our aim is that way, we can be open. I'm sure as I said, Sion Hospital has always cooperated for you. The issue is we will give information, but we will try to also see whether others will be able to help. And if others coordinate, probably it is also good for me because all patients coming to Sion some of them will go to other places. So at least there is some distribution networking can really occur. I think that's also a very good idea. So I'm sure that is what I'll do from my side. And I think we will try to support you as much as possible. That's the only thing I can say.
Dr. Aparna, what I would say, I totally agree with Dr. Supe. Now we are working with Sneha, another organization where the Additional Municipal Commissioner, MCGM, has ensured that the load on Sion Hospital for the very difficult cases of pregnancies which come from the neighboring areas of Thane, Kalyan, Bhiwandi, Mira Road, etc. are reduced. A protocol has been laid down that if somebody has to be moved in from the neighboring districts, whether it is from Mira Road or Vasai Virar or Bhiwandi or Kalyan or Ulhasnagar, to which Mumbai Corporation Hospital or Jaslok they would go. So there is an internal and an external protocol which has been laid down for the pregnant women, for example, to take care of emergency in terms of pregnancies as such and the outcomes. I'm pretty sure what Dr. Supe has said, that is doable. We can facilitate. Let us sit down as quickly as possible. As I said, I'm willing to offer my coordination or whatever services I have within the corporation area, within the government hospital, the central government hospital. That is the first network level which we can do, and then slowly get like-minded private hospitals. I'm pretty sure everybody will cooperate.
Thank you so much, Mr. Banthia. Dr. Rekha?
Yes,
amongst private hospitals.
Can you hear me now, Aparna?
I think we can't hear Dr. Rekha. So finally, Malathi, thank you so much for offering help to us, and I hope that we can all get together to make this a reality, and hopefully you'll find stories from us to write about.
Yes, that's the best part.
And hopefully that now, Mr. Banthia and Dr. Supe and Dr. Rekha, we're going to come to you and take your help, and hopefully in a couple of months we're going to go live with 11 hospitals, and hopefully that will spread to all the hospital blood banks of Mumbai city, and hopefully this panel discussion will be the impetus for us to go forward with renewed zeal to make hero possibility in Mumbai. Thank you so much. Thank you so much, Dr. Supe, Mr. Banthia, Dr. Rekha and Malathi for this very invigorating panel discussion. It's been very hard for us, this journey in Hero, to come to a point where we now have actually created a barcoded inventory system for blood banks, which we are implementing right now in Sion Hospital, and which will be replicated hopefully in other government hospitals if they agree. And we also created a Hero web app where private hospitals can update their data about availability of ICU beds and blood that Shushrusha Hospital already started using, and which we hope other private hospitals accept. We also already created an admission counter software for government hospitals for the real-time updation of data. And I hope this paves the way for a long journey for Hero, where we can have come to a point where every citizen of Mumbai can actually get real-time data about availability of ICU beds and blood through phone number, an SMS auto-reply system, a website, and a mobile app. Thank you very much, everybody. Thank you.
Sure.
Thanks,
Take
Dr. Aparna, for coordinating this. Thank you.
Thank you so much, sir. Yeah, thank you so much. Thank you.